Hi there, my name's Addison. I just graduated from the Doctorate of Physical Therapy program from the School of Allied Health this year, 2014.
Hi, my name is Tatiana and I'm a prospective dietitian, so I'm a student in dietetics.
My name is Jason and I am in medical school.
I am a Seventh-day Adventist myself, and the profession I'm going into is physical therapy.
Hi, I'm Ioana and I'm a medical student here at Loma Linda.
Hello, my name is Isaiah. I'm an incoming first year in medical school.
My name is Stephen Lee, and I'm going into medicine.
And I was asked a question about how health professionals can relate to the SDA kind of culture or with the theology of the SDA, or some dilemmas between the SDA community. And one thing I thought of was the difference, or in the SDA community we talk a lot about a vegetarian or even a vegan diet and vouching for that. And as in a hospital setting, we often see many non-Adventists or even non-Christians. And one dilemma might be, as an administrator, how would you draw the line between following what we believe as SDAs, or what I believe as an SDA, and vouching for the vegetarian diet, versus being more accepting and inviting to other people of other cultures. So that's something you guys can think about.
And one of the issues that come up with dietetics is with nutrition support, whether when someone is in a coma or in a vegetative state, whether nutrition support should be, well, one, like allowed, or two, prolonged, and for how long. And that's an ethical issue because it brings to the question, what does it mean to be alive? What is life? What counts as life? And yeah, and so that would be how it would affect Adventists and their beliefs, making that decision of what counts as life. And as for me personally, yeah, I'm still thinking about that as well. I don't really have a solid answer for myself, but it's definitely something to consider and look into.
And I think an ethical issue I'll face being a physician is working on the Sabbath. I know I've talked to a couple of physicians where that's been an issue for them, and they've struggled with the idea of keeping Sabbath and working Sabbath shifts and stuff like that. And I think I'll face it when I come around to being a licensed physician.
Some ethical issues that, as a practitioner, we might run into would be working on the Sabbath, which is Saturday. Seventh-day Adventists usually decide to worship and go to church or whatever they do on that day, but as a Seventh-day Adventist practitioner working in physical therapy, we might have to work on Saturday. That could be a problem that arises.
Hopefully, eventually in the future, I would like to become an OB-GYN, and being a Seventh-day Adventist and also working in the medical field, especially one that can deal with certain touchy subjects like abortion. There's a lot of things to take into consideration, especially when you're the one that's the practitioner. Usually you have to accommodate for your patients, and that's something that I've always kind of thought about and maybe struggled with a little bit. Like, if someone comes to my office and they say, I'm pregnant and I would like an abortion, what would my reaction be? Because a lot of the times you don't work just by yourself, you have someone that you're working for, and if you don't work for, let's say, a private corporation like Loma Linda, you work for like a county hospital, you don't really have a say in who you can turn away or not, because then that could bring a huge lawsuit. But then there's also like, how do you stand with it morally? And I'm still not entirely sure where I stand on the subject. I feel like I personally might not be able to do it. I don't think I could take someone's life. But I mean, you do still have the responsibility of helping someone out, and if they're going to be better off by not having to care for a life and, not having to potentially harm someone in the process of having a child because they don't know how to take care of them or they don't have the resources, then I could always direct them, I guess, to someone who has like less moral direction than me. I don't know. But that's something that I know has popped up in my life as I'm thinking about my future career.
One of the issues that I've been thinking about entering this career field is in that of abortion, mainly because being a Christian belief, it's very difficult to come to issues of life, death, and who has the right to grant life or to grant death or to sacrifice even sometimes. It's very difficult to be able to discern what would be the best options or what would be the quote-unquote right options, or even if there is a right option. So that would be the biggest thing that I would be concerned about of all the ethical issues entering the medical career.
An ethical dilemma in terms of religion and that kind of thing would be, for me, would be abortion. There's like a lot of different views on it. In terms of Seventh-day Adventists, if you read the fundamental beliefs that we have online, it says that in the case of rape or in the case of like if it threatens the mother's life, then it's fine. But in the case of just voluntary abortion, you know, they say that's not okay. But then there are other people who say that, you know, you should just not do abortion. So where do we draw the line, I guess?
Hello, my name is Zach. I'm studying to be a physical therapist. I'm answering the question on what religious or ethical issues might a Seventh-day Adventist face in the workplace. Some ones that come to mind would be, of course, the day of worship. Maybe you don't want to work on Sabbath or Saturday. I remember that in a hospital setting before coming here, the cafeteria dietary menu was an issue. If there are certain types of meat or whatnot, depending on how conservative you are as an Adventist, that could pose a problem. Otherwise, you have the same issues that a lot of other people face: sexual harassment, issues of abortion, or possibly medication, things like that. But overall, I would just say the day of worship and maybe some diet or possibly language type things like taking the Lord's name in vain. Otherwise, same old.